make or break week for the American people. House Democrats will continue to strongly oppose the GOP tax scam. The Republicans are to jam this big, ugly bill down the throats of the people, which will take away health care, impose the largest cut to nutritional assistance in American history, and hurt veterans, hurt children, hurt seniors, hurt people with disabilities, result in hospitals closing, nursing homes shutting down, of the fact that almost 14 million people lose their ability to access health care. People will die. House Republicans are trying to jam this reckless and extreme budget down the American people and hide what's in it, which is why, in an extraordinary way, they are holding a Rules Committee hearing to advance the bill at 1 a.m. in the morning. If this legislation is designed to make life better for the American people, can someone explain to me why they would hold a hearing to advance the bill at 1 a.m. in the morning? Because the Republicans know that their efforts to take away health care from millions of Americans is deeply unpopular. Republicans know that the effort to enact the largest cut to nutritional assistance in American history, which will literally take food from the mouths of children, veterans, and seniors, is unpopular. Republicans know that providing their billionaire donors with a tax break for people like Elon Musk, and at the same time exploding the deficit by trillions of dollars, is deeply unpopular. Republicans are going to try to advance this bill in the dead of night, 1 a.m. in the morning. Trump and House Republicans can run away from their extreme budget proposal. We will never let them hide. Question?
Thank you, sir. Given the revelations with President Biden's cancer down the release of the Her recording, why were Democrats not more open to talking about President Biden's age in 2024?
My thoughts and prayers have been extended to President Biden. It's a painful moment for him and his family. It's a very serious diagnosis. My expectation that President Biden conspiracy theories and want us to look backward at a time when they actually are taking health care away from the American people. No, as House Democrats, we're going to look forward. They literally are trying to take health care away from millions of Americans at this very moment in the dead of night. And Republicans want to fan the flames of conspiracy theories at this moment? No, thank you.
Thank you, Mr. Leader. Two quick questions, just to follow up on President Biden. Have you had a chance to speak with him at all since his diagnosis, or do you intend to? And then secondly, just on Medicaid, I know for many months now you've been warning about the implications of cutting Medicaid. It seems there's some renewed discussions about FMAP and putting it back into the reconciliation bill. What are your chief concerns if that happens?
I have not had the opportunity to speak to President Biden subsequent to the news of the diagnosis becoming public yesterday. I do expect at some point in time I will speak directly to him to more directly communicate my thoughts and prayers, and that of the House Democratic Caucus. In terms of the Republican obsession with taking away health care from the American people, this is something that they've been trying to do for decades. And who violently attacked the Capitol on January 6th, including police officers, and now have all been pardoned and sent back to communities across the country, where in some cases they're re-engaged in criminal activity. Donald Trump and the extreme MAGA Republicans are not going to be able to face what happened on January, no matter how hard they try.
Jeffries, thank you. Wanted to ask you about the discussion right now. Obviously, you still have a fair amount of New York Republicans who are not budging when it comes to this, but you have Republicans from other states that are saying one of the more heated conversations we saw was between Congressman Tom Suozzi and Congresswoman Beth Van Dyne during one of the hearings, where she said Texas isn't assault. And Suozzi kept asking her over again, well, what about the people of New York? Tell me about your thoughts on Republicans who want to keep the SALT cap where it is, but then they say that taxpayers shouldn't get a break for choosing to live. Do you agree with that, or do you think it's fair for Republicans from other states to say something like this?
Yeah, states like New Jersey and Connecticut and Illinois and California are donors. We regularly send billions of dollars more to the federal government than we get back in return. We are donor states. So we're not going to be assured by people who are actually in what has sometimes been referred to as taker states, who actually receive more money every year from the federal government than they send in terms of taxpayer dollars, as to what is fair and what is right. It's actually not fair that you have many states in the country who subsidize other states. New York subsidizes other states. And so to provide some measure of relief through the state and local tax deduction, I think is a modest step toward balancing the revenues that come in and the revenues that come out. The people of New York are fine with continuing to be a donor state. But it's unfair to cap the state and local tax deduction at $10,000. And my Republican colleagues are really interested in providing relief to middle-class taxpayers that they represent. Simply say and make clear that this budget should remain silent on the state and local tax deduction, because by doing nothing, the cap disappears effective December 31st of this year.
Thank you, Mr. Leader. Congressman Al Green said Friday that he would force a vote on his articles of impeachment against President Trump. Where do you stand on that impeachment effort?
Have a conversation with Congressman Green about it, but I look for discussion.
Can you just characterize, in your view, what the bill as it stands right now would be in your district and in your home state context of some of these battleground districts that you're going to be litigating in a year?
There are people who will lose their health care coverage across the state of New York and beyond, approximately 14 million in this country. Tens of millions of others going to pay higher co-pays, premiums, deductibles, because of the significant role that Medicaid plays in the healthcare ecosystem across this country. And if you effectively end Medicaid, know it, it will also have an impact that is damaging on people who don't rely on Medicaid for their health insurance, but are part of the same health ecosystem. Hospitals are going to close, nursing homes down, community health clinics will shut their doors, and people are going to die when their health care is taken away from them, all because Republicans provide a massive tax break to their billionaire donors like Elon Musk. That's the fundamental question that is before the Congress of Representatives this week. Democrats are going to stand on the side of the American people, their nutritional assistance, their access to higher education, stand on the side of veterans and everyday Americans and people with disabilities, children and seniors. And Republicans are continuing to stand on the side of their billionaire donors. And House Republicans in particular are once again bending the knee and serving nothing more than a rubber stamp for Donald Trump's extremism. Why he's coming up to the Hill tomorrow to give them their marching orders. As if House Republicans work for Donald Trump, J.D. Vance, or Elon. You don't. You work for the American people. And all we need are 4 House Republicans to stand up and do the right thing and push back against this one big, ugly bill, and we can actually save the health care of the American people.
Do you plan to speak with President Trump at all during this process or when he comes up here?
I have no current plans to talk to President Trump.
You've been very clear, I think, week after week about reconciliation legislation. Now, as we're heading toward the final stretch here, potentially, of the week, can you talk a little bit about Democrat strategy and your strategy to push back in the time that's left?
Well, every single House Democrat will continue to be strongly opposed to the Republican effort to rip health care away from the American people as part of their scheme to the GOP tax scam to provide massive breaks to billionaire donors like Elon Musk. We've held town hall meetings in Democratic districts, hall meetings in Republican districts. There have been speeches and rallies and marches and sit-ins and telephone town hall meetings and press conferences, all of which will continue in different ways throughout this week and beyond. Whatever happens in the House this week doesn't necessarily signal the end of this unless Republicans decide finally to walk away from it. Every single House Republican that chooses to vote for this reckless budget that will hurt the people they represent going to be held accountable. This week, next week, this month, this year, next year. And so I would caution my Republican to be very careful about how you proceed legislatively in terms of the votes you're being asked to, that clearly do not serve the best interests of the people we all are privileged to represent here in the House of Representatives. Last question.
Thank you, Leader. Republicans are using the package to prevent state Medicaid funding going to non-citizens. The governors in Minnesota and California have, in different ways, been cutting that off. Are they wrong to do that? Are Democrats opposed to cutting off state Medicaid programs that go to non-citizens?
What's interesting is that Republicans have tried to make this a talking point when, as far as I can tell, the overwhelming majority of people who are going to be their efforts to take away Medicaid and as a result will lose their health care are American citizens. That's the overwhelming majority of the 13.7 million people who are going to lose their health care because of Republican efforts to provide Elon Musk and their billionaire donors with a massive tax break. That's what's unacceptable. That's unconscionable. And that is what is un-American. Thank you.